Welcome to this video about rehabilitation after an ACL surgery. Have you torn your ACL? You're probably not alone. In the United States, it's around 200,000 people every year who tear their ACL. Approximately 90,000 to 130,000 undergo surgical treatment. This means that 45% till 65% of the people with a torn ACL choose surgery. In the Netherlands, it's about 9,000 ACL surgeries performed every year. But what can you expect? That's a crucial question because good preparation is essential, better in, better out. And today we'll share some tips and explain what you can expect from your first treatment session with the physical therapist. Are you preparing for your ACL surgery? Keep the 5 things in mind. First one, have a good knee extension. A full knee extension, symmetrical to the unaffected side, is a really good predictor how your knee will react after surgery. Exceptions, of course, are there, like a bucket handle tear can lock your knee, and full extension is not reachable. Flexion, second one, is also important, but less important than the extension. We try to focus to reach at 120 degrees flexion. Swelling, also important to focus on. We want a calm knee pre-surgery to have more calm knee after surgery. The fourth one is strength training. We focus on getting your muscles stronger, and you get used to also the exercises for after surgery, and we try to aim for a deficit less than 20% between left and right. And for the fifth, you can always do like a test or measuring on an isokinetic device, for example the Biodex, to see if you really reached the 20%. What can you expect after surgery? Here are some key points to keep in mind. The first weeks after surgery, rest is crucial. The movement under guidance of your physical therapist is also essential. Be prepared for swelling, pain and some discomfort. Your physical therapist will also give you living rules and home exercises. You will receive the specific exercises from your physical therapist to gradually improve the mobility and strength of your knee. And the key points: quit smoking. Smoking negatively affects your health and delays the wound healing. Stop at least 2 weeks before the surgery and try to maintain this for the first 3 months after surgery. Ask for help and build a support network of family and friends. Let them assist with grocery, cleaning and transportation to the physical therapist or hospital, or friends of course. Also important to meet and be social. After surgery, the first few weeks you will walk with crutches. So ask your physical therapist pre-surgery how to walk with the crutches. Your mobility will be limited, so you will need a lot of help from people around you. Also, climbing stairs can be challenging, so consider setting up a temporary bed in the living room or stay with someone who lives on one level. After your surgery, you will need a lot of aids. You can borrow them, rent them or buy them, so start on time before your surgery. You can think about crutches. A wheelchair for some people is optional and easy to be mobile. An exercise bike I really recommend to buy or rent one for home. Also compacts or another device for electrostimulation is really handy. Cold compressors or cool packs is very important to have. After surgery, you will be limited a lot in your mobility and freedom. So make sure before you undergo your surgery that everything is well arranged. Schedule enough recovery time, for example. You will be at home for the first 4 till 6 weeks, so you need to have time to heal. So important to coordinate your surgery date with your work and discuss the sick leave. Make also arrangements with your school or study program if you are still a student, and discuss important events and travel plans with your doctor and physical therapist if it's possible. Also, don't forget to schedule an appointment with your physical therapist for after surgery. Probably you're now interested in how it looks like after surgery. So we made this video specially for you. So we show you in this video Amber. She's in her early 20s and she's in this video 3 days post ACL surgery. During the procedure, they used a quadriceps graft, performed a lat or Lemaire procedure on her lateral side, and conducted a meniscectomy on the lateral side also. Curious about what the first treatment looks like and what to expect? Watch the video and discover what you can do to optimize your own rehabilitation. Amber had surgery 3 days ago. Her leg is still wrapped in a compression bandage to control post-surgical swelling. The surgeon used the quadriceps tendon for the graft, making it difficult for her to lift her leg independently. To lie down on the couch, she supports her operated leg with her non-injured leg. My goal is to help patients become self-sufficient and independent. This fosters a sense of control and confidence. My first impression about Amber is that she looks really relaxed and is in a good spirit. She gives me also the impression that she trusts the process and neither is fearful nor hesitant about mobilization of her leg and knee. Confidence in the process makes this initial phase much smoother. A great way to achieve this is by going through a pre-operative preparation phase together. Creating the right conditions, as discussed earlier in this video, and getting to know each other is key. Removing the bandage feels like unwrapping a present. For the patient, it is often a significant moment seeing their knee for the first time after surgery. The knee looks good, not swollen excessively, and the wounds have stopped leaking. We leave the plasters in place for now. I observe how she positions her leg. The knee is not fully extended, but the foot rests comfortably. Not shown in this video, but I always check if the passive extension is fully free. In Amber's case, it is, and is even feeling quite smooth. One of the most important exercises is learning to contract the quadriceps again. This should be done with minimal effort but maximum awareness. The more force you use, the more you compensate with other muscles. When contracting, be mindful not to engage the foot, glute or hamstring muscles. A good way to check if you're doing it correctly is to observe if the kneecap moves while the knee remains fully extended and doesn't lift off the surface. Proper muscle contractions helps improve knee extension, promotes fluid circulation in the knee and prepare the muscles for training. Goal of this exercise is to lift the foot and press the back of the knee into the couch. Perform quadriceps contractions 20 to 30 times every 1 or 2 hours. Bending the knee after quadriceps tendon graft is often challenging. The incision is on the top of the knee, an area heavily engaged during flexion movements. Proper explanation is crucial to build confidence. Pain in the graft site is expected, but gentle mobilizations and stretching are beneficial. You don't need to push through the pain, but repetition is key. Besides being a flexion exercise, this is also an extension exercise. After bending the knee, fully extend it again and press the knee back into the couch. Heel slides combine both flexion and extension. Goal for the first session, achieve around 70 to 90 degrees of knee flexion and perform heel slides every 1 or 2 hours and make 5 to 10 repetitions, aiming for 70 to 90 degrees. For the next exercise, sit on the edge of a surface, with both legs hanging over the side. The non-injured leg supports the operated leg, acting as a driver for bending and straightening the knee. Ensure full knee extension. When the leg hangs straight down, you achieve about 70 degrees of flexion, not 90. This exercise tends to feel more comfortable than heel slides, mainly because you only bend to 70 degrees. Goal of this exercise is mobilize the knee from 0 to 70 degrees. Perform this exercise every 1 or 2 hours for 10 to 20 repetitions. Besides learning to contract the quadriceps, it's also important to strengthen them. The straight leg raise is a great exercise to start with. After quadriceps or patella tendon graft, lifting the leg is often impossible in the first few days or even the first week. Preoperative quadriceps control can significantly improve postoperative performance, regardless of graft choice. Start by contracting quadriceps, pressing the back of the knee into the couch and attempting to lift the heel. Initially, lifting the leg may not be possible. Focus on making the leg feel lighter on the couch as if you're reducing its weight on a scale from 30 kilograms to 20 kilograms. The leg doesn't need to lift yet. Muscle tension will increase and after a few attempts, lifting often becomes possible. Be mindful that pain, especially in the graft area, may prevent success at first. That's okay. Continue practicing with the weight reduction concept. And as pain decreases, lifting will become easier. Goal of this exercise is to strengthen the quads. Perform this exercise 5 times per day, 1 to 5 minutes. Hold for 5 seconds with the left leg and 5 seconds with the right leg. Incorporate mirror training. If lifting is still too difficult, support can help. Use a towel or resistant band around your foot. Engage the quadriceps and use the towel to assist the lifting. As you improve, reduce the assistance. Life hack: turn crutches upside down to prevent them from tipping over easily. Walking with crutches. Try to walk as normally and symmetrically as possible, as if nothing is wrong. Of course, this won't be perfect yet, but the goal is a symmetrical weight distribution, prevent back pain and overloading the non-injured leg. A helpful tip is not to overthink it. Imagine stepping over a small threshold and focus on extending the knee fully when placing your foot down. We will continue Amber's rehab journey. Subscribe to follow her process over the coming weeks.